Do older adults still need sex? That's a question many avoid, but the truth is, many seniors still have private desires and often keep them hidden out of fear, shame, or old taboos. Did you know that masturbation is completely normal and healthy, even at age 60, 70, or 80? It's something healthcare professionals acknowledge, but few talk about it openly. So today, this video is your safe space, a place to learn about masturbation in later life without judgment, how it can benefit your physical and mental health, when it's safe and when it might be too much, and how to approach it in a healthy, guilt-free, empowered way. If you're watching and feeling a bit awkward, that's okay. Leave a comment with the number 1 if you agree this topic is real and important, but you felt uncomfortable talking about it. I'll be in the comments to support you, listen, and help you feel more confident. I've broken down the video into key chapters in the description below, so you can jump straight to what matters most to you, whether it's the benefits, the risks, or expert tips. But I truly encourage you to watch the full video, because each part builds on the last to give you a full, empowering view of sexual wellness in your later years. Part 1. What is masturbation? Is it unusual in old age? When people hear the word masturbation, they often associate it with youth, or something that should be avoided. But this is a big misunderstanding, especially as we grow older and still experience physical and emotional needs, just in a different form. So, what exactly is masturbation? In simple terms, masturbation is the act of stimulating your own body to create sexual pleasure, usually by touching sensitive areas such as the genitals. It may lead to orgasm, but it doesn't have to. Most importantly, masturbation does not require a partner and can be done privately, safely, and with self-respect. Is it strange or abnormal for older adults to masturbate? The short answer is absolutely not. It's completely normal. In fact, many medical studies have confirmed that masturbation is a natural part of sexual health, no matter your age. It can provide relaxation, stress relief, and help you stay connected with your body and emotions. A study by the National Institute on Aging found that 40–50% of adults over 60 still have some level of sexual desire, whether with a partner or through solo activities like masturbation. These numbers don't just reflect reality, they also remind us that there's nothing shameful about caring for your emotional and physical well-being as you age. Why do we feel ashamed talking about it? Most of the discomfort around masturbation doesn't come from the act itself, but from social and cultural taboos, where sexual expression in older adults is often seen as inappropriate or unusual. But the truth is, our bodies don't stop needing connection or intimacy just because we get older. The nature of desire may change from intense passion to deeper emotional connection, but it's still there. In this context, masturbation isn't about loneliness. It's about self-care, maintaining a sense of vitality, and staying in tune with both body and mind. Understanding and accepting this is a powerful step toward embracing whole-person health in later life. Part 2, the benefits of masturbation for older adults. When it comes to masturbation, we often hear negative views or see it treated as a taboo subject. But the truth is, when practiced safely and in moderation, masturbation can offer real, meaningful health benefits for older adults, both physically and emotionally. 1. Reduces stress, improves mood, and helps you sleep. Orgasms trigger the release of endorphins and oxytocin, natural chemicals in your body that help calm the nervous system and create a sense of well-being. For older adults who experience insomnia or anxiety, masturbation can be a natural, drug-free way to relax and sleep better. 2. Supports heart health and blood circulation. Even though it's not intense exercise, masturbation still activates the cardiovascular system gently and helps improve blood flow, especially in the pelvic area. For men, this supports erectile function. For women, it helps maintain vaginal elasticity and natural lubrication. 3. Keeps sexual organs active and responsive. As we age, decreased sexual activity can lead to changes in the body, like dryness, decreased sensation, or muscle weakening. Regular, gentle masturbation helps maintain function in the genitals and can prevent common problems like urinary discomfort or loss of sensitivity. 4. Promotes a sense of self-connection and control. For many older adults, especially those who are single or caregiving for a partner, masturbation is not a substitute, but a way to stay in touch with their emotions, their body, and their sense of self. It reinforces that you are still vital, still worthy of pleasure and self-care. 5. Safer than other forms of sexual activity. Compared to sex with new partners or situations that involve risk, Masturbation is a safe option. There's no risk of sexually transmitted infections, STIs, and it doesn't rely on someone else's availability or health. In short, masturbation is not just a physical act. It's part of holistic self-care in later life. It helps you stay connected, feel alive, and treat your body with kindness and dignity. Part 3. Risks to be aware of. While masturbation offers clear benefits, especially in later life, it's important to remember that, like any health-related behavior, there are a few potential risks, particularly if it's done improperly or excessively. Being aware of these risks isn't about fear. It's about staying safe and informed. 1. Physical injury from too much pressure or poor technique. Some people, especially men, may use too much force or awkward positions during masturbation, which can lead to soreness, irritation, or even tissue damage. As we age, our skin and soft tissue become more delicate and slower to heal. That's why it's important to be gentle, patient, and to listen to your body. 2. Risk of overuse or compulsive behavior. Though rare, some individuals may use masturbation as a coping mechanism for emotional distress, loneliness, or boredom, and may feel the urge to do it too frequently. If you find yourself unable to control the habit, doing it multiple times a day, or feeling physically and emotionally drained, it may be a sign to speak with a doctor or therapist. 3. Potential cardiovascular strain for those with serious conditions. For people with heart disease, high blood pressure, or a history of stroke, orgasm can cause temporary changes in blood pressure and heart rate. While this is usually harmless, if you experience dizziness, chest pain, or shortness of breath during or after masturbation, consult your doctor to rule out any risks. 4. Feelings of guilt or shame. Some older adults report feeling guilty or ashamed after masturbating, even though the act itself is harmless and natural. These negative emotions often stem from outdated beliefs, cultural pressure, or lack of accurate information. It's important to know that masturbation is a normal form of self-care, and there's nothing wrong with taking care of your needs. In short, masturbation is not dangerous when practiced safely, moderately, and with self-awareness. And if you ever have health concerns, don't hesitate to talk to your doctor, because caring for your sexual well-being is caring for your whole self. Part 4. Expert advice: how to masturbate safely and healthily. Now that we've explored both the benefits and risks, the key question is, how can masturbation become a safe and healthy part of your lifestyle as an older adult? Here are some practical tips from sexual health experts specifically for seniors. 1. Find the frequency that works for you. There's no correct number of times to masturbate. What matters is that you feel physically comfortable and emotionally relaxed afterward. For most older adults, 1 to 3 times per week is reasonable. It helps maintain function without fatigue. If you're dealing with chronic illness, fatigue, or poor sleep, consider discussing with your doctor first. 2. Maintain hygiene. Before and after. Wash your hands thoroughly before touching intimate areas. Gently clean your genitals with warm water afterward. If using sex toys, make sure to clean them before and after use and store them in a dry, clean place. 3. Choose a private, calm environment. Set aside time in a quiet, private space where you feel safe and comfortable. This helps you relax, focus, and enjoy the experience without fear of being interrupted or embarrassed. 4. Use lubricant if needed. With aging, the body naturally produces less moisture, especially in the genital area. Using a water-based, fragrance-free lubricant can reduce friction, prevent irritation, and increase comfort. 5. Balance it with a positive lifestyle. Masturbation is part of healthy aging, but it shouldn't be your only emotional outlet. Balance your life by doing light daily exercise, spending time with friends or loved ones, enjoying hobbies like reading, music, art, joining senior groups or social activities. When practiced mindfully and with care, masturbation can support your sexual well-being, help you feel in control, and add more joy and connection to your life at any age. Inspirational Closing, Ion. Now that you've made it to the end of this video, maybe you've realized something important. Sexuality doesn't have an expiration date. Masturbation is not strange and certainly not shameful. It's simply a natural part of being human, even at 60, 70, or 80. As we grow older, many things change. Our health, our appearance, our relationships, even our emotions. But that doesn't mean we lose the right to feel love, connection, or joy within our own bodies. Taking the time to learn about this topic, to reflect on it, and to accept it with an open mind, that's an act of courage and freedom. You don't need a partner to feel loved. You can love yourself, care for yourself, and live fully on your own terms. In a world where older adults are often seen as past their prime, speaking up about your needs, even private ones, is revolutionary. It breaks down old taboos and opens up a new vision of aging, not just living longer, but living deeper. So if you've ever felt embarrassed, if you've ever thought, that part of life isn't for me anymore, remember, it's never too late to love yourself, to rediscover who you are and to honor your needs with dignity and pride.